Welcome back, WNST, Towson, Baltimore, and Baltimore Positive. Nothing more positive than the vaccine being on the way. Don Moeller joining us here on behalf of all of our friends out in Catonsville. Stay fair, El Guapo. Evan Brown's coming on next week. We're going to talk about the tequila out there. We're going to talk about the chicken and waffles. Also, our friends at Fadley's are delivering those crab cakes all over the world. I went over a couple of days ago. Some oysters over there. They got some fresh fish I brought home as well, and coming to Catonsville soon. Don, one of your favorites on today, and I know since the last time we had the doc on, there was some concern here about coronavirus, and not just, for us, for the doc himself, right?
Well, we have the director of Baltimore County's Department of Health and Human Services. He's a veteran of Baltimore Positive. Great to have him back on, Dr. Gregory Branch. Doc, welcome back to Baltimore Positive.
Good day, good day, good day, good day to you, Nestor. Good day to you, Don, and a virtual fist bump to all your listeners.
Well, hey, you're not allowed to have more energy than the host. I set a very high bar around here, Doc.
Well, do you know what? Then you've invited the wrong guest, because I have a whole lot of energy.
Doc, I'm going to jump right in and start with the congratulations. Anyone who has listened to the show knows my experience. And my experience really encompasses a couple of things. Getting a Saturday night text from my daughter who said, "Hey, Dad, I think they've opened up some sites at marylandvax.org." So my wife and I jumped on, and sure enough, we were able to get on quickly. And within a couple of minutes, when I told my friends about it, it was already taken. As you're well aware, those appointments fill up like that. So we end up at Timonium, and we pull into Timonium Fairgrounds, and the parking lot is packed. And we're thinking, oh, Lordy, we better go get some lunch. We're going to be here a long time. Well, Doc, from the time we pulled in to the time we pulled out, I want to say it was maybe 58 and a half minutes. That included the 15-minute wait time for the observation. And while we're waiting for the observation, your staff gets us scheduled for the second appointment. Truly a machine that's actually been recognized by the governor. So congratulations, Dr. Branch and Baltimore County and County Executive Olszewski.
Thank you so much, Don. We are so glad to be able to do this. We have been practicing to do this type of mass vaccine for over 10 years. That we've had the flu vaccine clinics that we had, which were our big Saturday vaccine clinics that we would have in 7 councilmatic districts, our Super Saturday. And we've been practicing that every year since H1N1. And so at this particular time, we've got it mastered. And since you've been there, I can tell you that we're doing it very, very quickly. You have a Disney experience, because if you come off the parking lot and you can't walk to the building, we have the police cadets driving you to the front door. We've got transport folks there with wheelchairs. And I can tell you right now, we are right now doing about 700 people per hour. And there is less than a 15-minute wait, not including the 15 minutes that you have to wait for afterwards. So we've got this thing now mastered, and we can probably do 1,000 an hour very, very easily. We are the mass vaccination clinic in the state.
Oh, Doc, I don't think there's any doubt. I mean, from what I read, from what I gather, the incredible kudos that County Executive Olszewski and you and your team are getting, because you'd be the first to say it's a team. You say we could do, if we had the vaccine, we could do 1,000 an hour. Here's what I don't know. It's funny, I should know this. What hours a day? How many a day does that equate to? I'm not sure how many hours you stay open out there. So what does that mean per day you could do?
Oh, well, I can do as many hours, up to 24 hours, if somebody gave me vaccine. But the reality of the situation is the fact that at this point now, I only get 5,000 vaccines per week. So I do that in 3 or 4 hours.
So, Doc, you're still, when I look at, and I want to direct people, because Nestor's a numbers guy, and we're going to get into the numbers as well. I want to direct people to the website, baltimorecountymd.gov. Right there on the front page, there's everything you need to know about COVID. You hit it, you've got this incredible dashboard that people can look to. And when I look at that dashboard, if I
What's
read
the
it
website?
correctly,
What's the website, Doc?
BaltimoreCountyMD.gov, right, Doc?
Got it.
Go ahead. I didn't have the MD in there. Go ahead.
BaltimoreCountyMD.gov. So it looks to me like we're still in 1A. Is that correct, Doc? Walk us through the phases.
Yeah, okay, so we are in 1A and 1B at this particular time. And that means that we are doing the healthcare workers, and then we're also doing folks who are in 1B, which is predominantly the 75 and older, and obviously the school system. At this particular time, we are still there. I cannot move to 1C because that's going to be 65 to 74. Let me give you some numbers. I've got over 250,000 people who are on my registry as of today. I have 45,000 folks who are above the age of 75. And so what happens if I'm only getting 5,000 vaccines per week, it takes me a while to get through that. So at this particular time, until we get more vaccine, I'm not going to be able to get to 1C and to 2 and the general public.
Well, what's your sense of that? I had someone the other day reach out to me who they weren't angry per se. They were frustrated. They felt they were in their 70s. They felt they had signed up correctly on a link. They had an appointment, and then they got an email saying, I'm sorry, but the appointment that you had was for second doses only, so you can't come keep this appointment. And then they weren't directed necessarily, or they weren't directed, not necessarily, they weren't directed to do anything other than to go back and start again. So they're in their mid-70s, and they're frustrated, and they're pretty tech savvy, trying to navigate again. Any advice for folks? I know you're frustrated because, as you said, you're only getting 5,000 doses a week.
So what happens is when you come to our clinic, when you get your first dose, at that clinic, we give you a URL at the clinic so you can make your second dose. And what we clearly say is, do not share that URL. Unfortunately, people then share the URL, and then they're sharing it with people who need their first dose. When the federal government gives the state, which gives the local government our doses, they give us first doses and second doses. And so
they are different shots, correct?
Excuse me?
They are different shots. The first shot and
Yeah.
the second shot are different, correct?
Different. The same exact brand, but it's two different shots. And so therefore, when I have a second dose clinic, I am bringing enough for the people to get their second doses. If you try to jump in there as a first dose person, I cannot serve you. And when you see the links, it clearly says second dose clinic. So they were not supposed to get that. I am sorry that they actually got that. And what I can say to everyone is, please be patient. Once the supply increases to a point where we can actually fulfill the demand, we won't have this issue.
Well, Doc, you mentioned first and second dose. There was a recent article, there have been many, but I read one, I guess, just in the last few days in the Atlantic, where they get into the reasons that things have been slow. And we know with the Biden administration, things are picking up. But there's this debate out there whether we should scrap second doses for the time being and go first dose only. Because I want to clarify a question that Nestor asked when he said the doses are different. The chemistry of the doses it's the same vaccine, right? Just scheduled.
See, I didn't understand that. So I'm getting salt twice, not salt and pepper. Correct?
Yes, if you want to think of it that way, Nestor, yes.
The same serum twice.
Yes,
Understood.
exactly.
Okay. So I did not know that. I'm learning things here, Doc.
There you go. So the question for the doc then and I know people are all over on this, and I'm not sure where I am. I think I sort of prefer to be where the CDC is right now, which is, I think, still, let's still go first dose, second dose, rather than skip that second dose. Put your medical hat on, Doc. Take your government employee hat off. Put your medical hat on. Where are you in that controversy?
2 doses, period. That is what the studies have shown. After 1 dose, the efficacy is not as great as 95%. Therefore, you need to have 2 doses at this particular time. That's what the studies have shown. It's not a good thing to start changing things midway when you do not have the evidence to back that up. The studies have shown it to be not 1, but 2 doses for Pfizer and Moderna. There will be others that come out, a different serum, a different salt, Nestor, that's going to come out that you only need 1. But those studies will tell us that you only need 1. So it goes by how the study is. You cannot change it midstream, because then you don't know what you're doing.
Well, one thing we know that's going to change midstream, Doc, mutations, right? I mean, the South African variant, and by the time I get around to getting the shot in the spring, there'll be a number of them. Tell us about mutations and variants from a medical side and things to be concerned about here, because I'm sure from the very beginning, a year ago when this thing began, you've been following all the medical side of this to try to figure out where we were waiting on these vaccines the whole time, and we're still not. There's still going to be more vaccines coming from Johnson & Johnson, right?
Right. So let me just explain to you as simple as I can. I got to tell you what's in the vaccine, and then I can explain to you about the variants. When you get a vaccine, Moderna or Pfizer, we're only talking about Moderna or Pfizer, it is called a messenger RNA vaccine. What does that mean? That means that we are actually injecting into you a genetic material. The genetic material that we're injecting into you does not change your DNA. What it does is it actually tells your cells to make a protein that mimics the outside face of the virus. So basically, your cells will make a picture of the face of that vaccine, so that when the vaccine is introduced to your body, your cells say, oh, I know you. You are an invader. I'm going to kill you. That's what it's supposed to do. When it comes to the variants, what happens is the virus says, I need to change because I keep getting killed. So for survival sakes, what the virus does is this virus then puts on some glasses and then comes in, and the body says, I still know you. It's the same person, but you got glasses on. And another variant puts on a hat. I still know you. Another variant puts on a mask. I still know you. And then what happens is a variant puts on a hat, glasses, a mask, and then the body says, I don't recognize that. Our goal is to be able to vaccinate everyone before the virus produces enough change in the variant that the body doesn't recognize it.
Is that big trouble 2, 3, 4 years from now for those who don't get the vaccine? Like we talk about everyone getting the vaccine, herd immunity, and again, Doc, I took horticulture in high school. Don Moeller transferred me into that class after journalism, so I didn't make it to Schulen's biology class. But part of this would be grave concern for folks who do not get vaccinated, in the same way that, like, my parents wouldn't let me roll around without a polio vaccination, right? Or, chicken pox, all those kinds of things, booster shots that I had when I was a kid from Dr. Wells.
But that's to understand it. It's not only those people. Remember, if there are people who don't get vaccinated and the variants change enough significantly, then the people who were vaccinated can't protect themselves against it. It becomes a new virus. So it's very important that everyone gets vaccinated.
Dr. Gregory Branch here from Baltimore County, joining us and educating us on all things vaccines, mutations. I do want to take folks out to the website just here briefly because, you know, it is the front door for most people. Now, folks, I'm sure some older folks, like my mom was still here, she'd want to call and not get online. But for most of us, we can get online. All the vaccine distribution data is available on the website. You can see right up to the day. I'm sure your staff's updating this every single day, how many people have been vaccinated, first dose, second dose, and then lots and lots of frequently asked questions and answers here that and priority group tiers. And unfortunately, I'm too, or maybe fortunate. My wife is higher than that because of her leukemia. But we're trying to figure this out. We live in the city, and I would say to both of you that, you know, we live next to the convention center. We live up high. Even we're watching it snow here today as we're taping. But every day we're seeing lots and lots and lots of people. And I think by and large, our area, and you two can speak to this, we've done a pretty good job of letting people know. And there has been, at least in the early going, a chance to sign up. Don, I know you, your wife, your family. I have, you know, my stepbrother, lots and lots of people who lives in Baltimore County have at least made this step. Peter's mother. So this is not something, your neighbors are getting vaccinated right now, correct?
Yeah, oh, absolutely. You know, I know a fair amount of people, certainly a number of teachers. And Doc, I know that's a concern. Maybe you can talk about our success with getting teachers vaccinated. It was interesting. I saw Jake Tapper last night tweeted something out, and I had sort of been thinking along these same lines. But Jake Tapper said, "I don't get it. We're trying to get schools open. In the nation, we have 3 million public school teachers, roughly. I think it's 3.2 million public school teachers. We're giving about 1.5 million doses of vaccine out a day. If we assume that roughly 30% of the teachers have been vaccinated so far, that would be what, 900,000. So we've got a couple of million teachers left. I think what Tapper is suggesting is, why don't we just across the nation, Doc, and I know this is above your pay grade, so to speak, but why don't we just say for 3 or 4 days in a row, we're going to put a moratorium on vaccinating everyone else, and every teacher, let's get them vaccinated, so that at the end of 3 or 4 days, we literally would, other than the ventilation issues, which I don't want to poo-poo, but at least we'd have teachers vaccinated so they'd feel safe. What's wrong with that approach, Doc?
There are people who are above the age of 75 who are dying every day. The teachers are not dying. And I have to say it as bluntly as that.
I appreciate you saying it bluntly, because that's a pretty good answer.
I have, from a public health perspective, one of my goals and my jobs here is to save lives. And so it is one of those things that we've got to be able to balance this as best as possible. And the reality of the situation is that it's just a matter of there's not enough vaccine at this particular time. But once the vaccine comes in, we will be able to do that. But Nestor, you brought something up, I guess, wanted to say. You said that there may be a person out there who would prefer to make a phone call. If you're in Baltimore County and you've got some questions, you can call 311. But you can also call the COVID hotline at the health department, which is 410-887-3816. I'm going to repeat it, 410-887-3816. And our hotline is open usually 7 days a week. But if you really have some questions or you have some concerns and you're not tech savvy, please feel free to give us a call and we will assist you. And if you're a person who's not tech savvy and you're trying to get an appointment, when you call us, we will take your information and then we will have somebody from the Department of Aging to call you back to help you make your appointment.
Is there a mobile that brings it out to folks? Do we have that? Not on icy day, but on normal day.
Well, you know what? You're kind of stealing my thunder to a certain degree. I haven't made the announcement yet, but that will be coming.
Breaking news! We're breaking
Come on,
news.
Doc.
See,
Come on,
breaking
Doc.
news.
So,
See, Doc, I knew when the bookmobile came by in Moeller about 6 months ago, because he's run some government, started talking about bookmobiles coming out to people, and I thought, that's a good idea, and I knew you'd come up with it.
Yeah. So we're going to have some wonderful things going out. I won't talk about them too much at this particular time, but obviously we have to deal with the population who are homebound, and we're going to definitely deal with that population too. And then also we're going to deal with the folks who are reluctant. You know, Black and brown people are reluctant a lot of time to take these new medical therapies. And so I want to be able to go out to the communities to be able to vaccinate folks, because it's so important, especially given the fact that Black and brown people succumb to this disease and suffer from this disease at much, much greater proportions.
Doc, pick up on that point, because that was another thing in the Atlantic article that I read. They highlighted that they believe nationwide there's still some concern as we try to get to herd immunity. It looks to me, in my layman's view of things, when I read that herd immunity is accomplished when we get to somewhere between 70 and 75, 76% of the population vaccinated. Numbers still point to evidently about 30% of our population still reluctant to get the vaccine. So I want to give you some oxygen on that. People are afraid of the vaccine. Should they be afraid? And if you're just sitting one-on-one with someone who says, Doc, I love you, but man, you know, I'm nervous about a vaccine, what do you say to them to put their mind at ease?
I want to just say that when we talk about Black and brown people and the history of what they had to endure from the medical community in the past, we have to recognize that it is understandable that people will be reluctant as it relates to a new vaccine. But let me say this. I am in 2021 at this particular time. And please, I am not in any way, shape, or form washing away what has occurred. I am not. It's real and it's there. However, I have people in the Black and brown community, and I've got people who are dying today. And in 2021, I know that there are Black and brown people who were in the, who created this vaccine for everyone. And what I'm saying at this particular time is, in order to save people's lives, I am recommending, as the health officer of Baltimore County, that everyone get the vaccine. Now, I'm going to be a little bit blunt, Nestor, and I'm going to say this. Please don't tell me that you don't trust me as a health person because you don't trust the healthcare system, so I'm not getting the vaccine. The reason why I'm concerned about that is because once you catch COVID and now you can't breathe and you short of breath, the first place you come into is who? Me.
You.
Right? So you say you didn't trust me when I told you for the preventive, but when you catch the disease, you're coming to me asking me to do
well,
what?
Doc, this is like talking to my wife about leukemia. She had it. She can tell me about it. You've had COVID, right? I mean, we were worried about you, and we haven't even talked. We were 20 minutes into this, and I brought it up first. Just how are you? And tell us a little bit about your journey in getting it, because that is the consequence of not getting the shot, right?
Right. So I got I got the virus obviously, and I caught it before vaccines came out and all that kind of stuff. And I was very, very careful. You know, I was actually washing my hands, watching my distance, wearing my mask.
How
But
do you
lo and
think you
behold,
got it, or do you have no? You'll
I
never
have
know.
no idea. I will never know, Nestor, at this particular time. But I can tell you this: as soon as I became symptomatic, I quarantined myself. I quarantined myself from my family and everyone. And I can tell you, thank goodness that no one in my family got the COVID once I had it. Everybody else did not get the COVID. I had a relatively mild experience with it. Thank God. And I know that there are other people out there who have not. So I was blessed in that I had a very mild case of it. So yes, I had a cough, I had lost my voice, I had a little some fevers, but I had like the flu-like symptoms. Other
Which
than
still
that,
isn't a
that
lot
was
of
it.
fun, by the way.
Not a lot of fun, but I didn't have to go to the hospitals or anything like that at all, right? So I came through and I have no residual effects of that. So I've been blessed with that. However, there are people who are out there who are getting this, who are dying. I know families that one person in the family had a mild case. They basically lost their sense of smell. One other person in the family is in the intensive care unit, and another person in the family has died.
Wow. That's, it
Well, these were
really,
the stories we were hearing from Italy last
Right.
year, Don, right? I mean, in the
Yeah.
beginning, we were hearing about Italian families burying loved ones, not being able to go out. I have a friend who lives in Italy. I was about to invite her on the show as some sort of she was wearing a mask at the time, and over here, we're having a party, right? I mean, not a little mask. I mean, like a gas mask kind of thing in Italy. And that was literally a year ago this week. I saw it on my calendar. And to think of where we are and the numbers and what it's done, I think, to our society. Doc, I wanted to ask you this because you talk about flu shots, you talked about the 7 locations you've had set up all these years, sort of a dry run for this. The notion that if we would have a lot of vaccines, tell me about the governmental side of finding people, stopping everything you're normally doing and running a vaccine. What we're trying to do for everyone in the state right now. This is a different kind of a rollout than probably anything we've ever done, right?
So yes, but let me just say something. Let me make something very clear to you, Nestor, and to you, Don. I cannot afford to stop everything else I do. Tuberculosis hasn't stopped. Sexually transmitted diseases haven't stopped. When you go to a restaurant, you can go to a restaurant and feel comfortable eating there because public health is on the job. I still have to do all those things. And on top of that, I'm still running a hotline. I'm still running contact tracing. I'm still doing outbreak investigation. I'm still doing testing for COVID. And now I'm still doing vaccinations. So I got to do all that stuff on top of what the normal job is in public health to keep the public safe. And I didn't have all those resources.
Well, no
And
one
so,
did, right? Literally, there's no municipality that was ready for this in that way with human power,
basically,
right?
we're basically trying to build. We are flying a plane while we're building it. That's
Doc,
exactly what we're doing at this point.
This is Baltimore Positive, Nestor, real time. While we're chatting with the doc, I get an email from the Baltimore County Health Department confirming my second dose appointment, doc, coming up in a few days. Thank you for that. Thank you, Baltimore County. My wife and I will be there. But then it says, here's what you need to bring. And one of the things that it says I need to bring is my COVID-19 vaccination record card received at when I got my first dose. Doc, I'm going to be upfront. I don't know if I have that. What if I don't have that? I need some guidance here.
All that preparedness he taught me in high school, Dr. Branch.
I didn't know about that card. Maybe I have it. Maybe I don't.
So therefore, Don, I am not going to give you that second dose. You will not receive it. No, not at all.
And you're not going to give it to me either because I haven't had the first one.
Okay, so let me explain to you, Don. We ask people to bring those cards. It's very important, but you can just bring your ID. Okay. But it's important to bring the card, and I'm going to tell you why. Because you know that we talked about there were 2 different types of vaccines. There was the Pfizer and the Moderna. And we have been giving out the 2 different vaccines. So that when you come in, if I'm having a clinic, and I usually don't do this, but if I was, I know that my Pfizer clinic has a certain color card, and my Moderna clinics have a certain color card. So if you walk in for your second dose with the wrong color card, we can stop you at the door and say you're not supposed to be here because we don't want to mix those vaccines together.
No, so I appreciate that. I appreciate it. And I will check as soon as we're done this segment. Hopefully it's in my wallet. Hey, Doc, we promised your staff we'd get you out of here in a half an hour. We try to honor that. Before I let you go, though, I've been really fascinated, and boy, you educated me over the years about the flu. You mentioned washing the hands. You were the first one that said to me, sing happy birthday twice, Don. Sing happy birthday.
By the way, that's why Cal Ripken never shook hands with people.
Well, Dr. Branch he'd say, Don, sing soap and water, saying happy birthday twice. I'd say, well, how about just water? Doc, I want you to know I was paying attention. You said, no, that's no good because water actually helps grow the virus. You need soap and water, saying happy birthday twice. Well, we've added to that now as a result of COVID. Most of us who are normal in the normal world, and I loved your outrage earlier when people said they didn't trust you. In the normal world, not somewhere in Jupiter, Florida, people actually wear masks. And article after article is pointing out that the flu, while having not disappeared, is at incredibly low levels. So my question for you, I said to my wife the other day as we were walking into the supermarket and we all had our mask on, I said, you know, even after COVID's gone, I'm not sure we won't be wearing masks to places like the supermarket and things, at least during winter, because of what we've learned about the flu. Am I on to something there? What's this tremendous drop in the flu all about?
I think you're on to something. There's still being studies to figure out what that is, but I clearly agree with you. If people really wash their hands, watch their distance, and wear their masks, you're going to not only decrease the coronavirus, you're going to decrease any and all other flus. So yes, doing that will help protect you and will hopefully help protect other people. So that's a wonderful thing. So you can get it with, diamond studded. You can get different colors. It can match your outfit. You can make it match your eyes. But keep doing it, Don. It's not going to hurt.
I got one.
I bet you're styling, aren't you, Doc? I bet you got a number of men.
Matches his bow tie, matches the whole deal, I'm
you.
sure. Doc, last thing for you. My wife's a 2-time leukemia survivor. She's put a lot of thought into these vaccines and the Johnson & Johnson coming and the 1-shot, the 2-shot. She is not eligible yet, but on the cusp, right? And she's seen of other leukemia people, and she's in a circle of survivors, that the Pfizer may be a better method for her than the Moderna. Can you decide which one you want and get in the line and say, I don't want the Moderna because I don't feel good about that. I feel better about the Pfizer. This is just my wife, and it's early going, and she's looking into this. But I did on her behalf because she's working on engineering in the other room. Wanted to ask you that question for her.
Well, what I will say is everyone should talk to their provider, their physician, their oncologist, if they have some questions about the specifics. I'm speaking as the public health officer. If you're invited to a clinic to get a vaccine, you take the first one that they give you.
Wait, Doc, I'm glad you said that. And boy, I know you've got.
See, my wife won't want to hear that if she's looking at studies and she's been in a hospital 155 nights fighting for her life.
So
she wants the better one.
So no. There is no better one in that sense. But talk to your doctor. Have her speak to her physician about that. But as the health officer, let me make it very clear: the first one that you can get, you take it. But Doc, period.
Doc, because it seems to me, and this it wasn't on your end. I think it was really on the federal level, and they've tried to rectify it a little bit. It seems to me they had a communication problem from Jumpstart on Johnson & Johnson, because what got lost in Johnson & Johnson, they wanted to point to the 70% or the 72% efficacy, which was slightly less than Moderna and Pfizer. But then there was another bullet point that didn't get reported for a couple of days, and that bullet point was that it was 100% effective in preventing severe symptoms and hospitalization. It seems to me that's what I care about, is I want to make sure I'm not going to get really sick and end up in the hospital. And what I hear you saying is that each one of these vaccines appears to have 100% success in doing that.
Exactly. And the fact of the matter is that you want to be protected. You do not want to sit around and waiting. So I don't know which vaccine I'm going to get week to week. I have no idea. So therefore, if I'm inviting you to a clinic, when the clinic, when I invite you, I tell you what I'm giving you. But the fact of the matter is that at this point now, vaccine is so scarce. The supply is so low that if you get an opportunity to get vaccinated, you take it.
Perfect.
Okay, Doc, last point before we let you run. I promise you're out of here. So people are out there, they're listening. They're 65, they're 70, they're 75. They still haven't gotten on a list. what should they do? Should they be trying every website as the state said? What's your advice to people? When you go to church and people say to you, Doc, what's the best way? Should they try, just keep trying on all the websites? What do you tell folks?
Well, in church, I say, praise the Lord, everybody. And then I say to them, okay, let us pray, right? But no. What I tell people is the fact that it's not going to hurt if you put your name in different locations. This system is the system that we have. I'm not saying it's the best. I'm not saying it's the worst, but it's what we have. So I would say, if it were me, put your name, but be patient. It's going to happen, I'm telling you. Once the supply comes in Baltimore County, I will be able to get those vaccines in your arms pretty quickly. But we have to be patient at this particular time because we just don't have the supply.
Well, once again, congratulations to you, to your team, Baltimore County Executive John Olszewski, for making Baltimore County truly the model around the state. And it was great to see the governor come out there the other day and recognize us. Nestor, did you learn something today?
I learned a lot. I learned I got to go have a talk with my wife about the Pfizer and the Moderna vaccines. Dr. Branch, we appreciate you, as always, keeping us safe and keeping us informed as much as anything. You can all go out to BaltimoreCountyMD.gov, click on the coronavirus tab. Very, very easy to get a lot of questions answered, and hopefully we answered some of your questions. He is Don Moeller, former Baltimore County Executive, on behalf of all of our sponsors at Fadley's and State Fair and El Guapo and down the line, and our friends at Liberty Pure. We are WNST.net, AM 1570, Towson, Baltimore. We never stop talking Baltimore positive.